You may think it is just age catching up with you, a small ache here, a strange spot there. But sometimes, what seems harmless can be your body whispering a warning. And after 60, those whispers can turn into shouts if ignored too long. This is not about fear, it is about awareness, because the body remembers what we overlook. Today, we are going to look at 5 specific body spots that too many seniors brush off. One of them, it could save your life if you pay attention in time. If you or someone you love is over 60, this video could be more important than you realize. Hit subscribe so you do not miss future health alerts like this. And if anything we mentioned today feels familiar, drop a comment. You might help someone else take action too. Body spot 1. The upper back or shoulder blade area. The silent alarm many seniors miss. It usually starts as something small. A dull ache when you get up from bed, a little tension after working in the garden, a tightness that feels like you slept wrong. Most people over 60 would dismiss it with a shrug and maybe a heat pack. But that discomfort between your shoulder blades is not always just a muscle issue. It can sometimes be your body warning you about something much more serious, your heart. You see, the way we experience symptoms of heart trouble changes as we age. Younger adults may feel that classic pressure in the chest or shortness of breath, but seniors often report vague signs. One of the most ignored is discomfort in the upper back, especially between the shoulder blades. It does not feel dramatic or urgent. That is what makes it so dangerous. People wait, they stretch. They think it will go away. And by the time they seek help, the condition behind that pain may already have progressed. This area, the upper back, sits near several major nerves and blood vessels. When something goes wrong with circulation or the heart, the pain does not always show up where you expect. It can radiate or reflect to nearby areas. In fact, for older adults, shoulder blade discomfort has been reported as one of the early signs of cardiac issues, especially among women. It might feel like a burning sensation, a band of tightness, or even a deep ache that gets worse with effort and better with rest. This type of pattern, worsening when you walk or climb stairs and easing when you sit down, should never be ignored. Another common mistake is assuming it is just arthritis or aging posture. And while those things can absolutely cause back pain, you must be sure of what you are dealing with. Age makes the heart more vulnerable to blockages. Arteries can stiffen, and high blood pressure or cholesterol may slowly narrow your blood flow. The result? Your heart has to work harder. And when it does, it may send signals to areas like your upper back long before any chest pain begins. Some seniors describe it as a pressure, others as a sharp pinch near the shoulder blade. Sometimes it even feels like indigestion or a pulled muscle. That is why many seniors delay going to the doctor. But if the discomfort is persistent, comes with lightheadedness or nausea, or happens after movement or mild exertion, you need to take it seriously. Another danger is that this type of pain can come and go. It may last a few minutes and then disappear for a day or two. But just because it vanishes does not mean the cause is gone. In many cases, these are small warnings like flickering lights before a power outage. If you catch them early, you may prevent a more serious episode. But if you ignore them, the body will eventually reach a tipping point. So what should you do if you feel discomfort in your upper back or shoulder blades? First, take note of when it happens. Does it appear during physical activity or emotional stress? Does it go away when you rest? Does it come with any other symptoms like fatigue, dizziness, or cold sweat? Keep a journal if needed. Next, talk to your doctor and do not downplay your symptoms. Mention that you have heard that upper back pain can sometimes relate to heart health. A good doctor will take that seriously and may suggest tests such as an EKG, stress test, or imaging to rule out any issues. Also, be proactive with your overall heart care. Keep your blood pressure in check, monitor your cholesterol, eat heart-friendly foods, and keep moving in ways that suit your mobility. And most importantly, trust your instincts. If something feels off, it probably is. The goal here is not to scare you. It is to remind you that your body sends signals. It remembers what you ignore. And sometimes the smallest pain in your back is the body's way of tapping you on the shoulder and saying, please, listen to me. If you know someone over 60 who has been having mysterious upper back pain, share this information with them. It might be just a sore muscle, or it might be something more. Either way, it deserves attention. Because after 60, your health depends less on what hurts and more on what you choose not to ignore. Body spot 2, the lower legs, especially around the shins or ankles. What your legs are trying to tell you. For many seniors, the lower legs are just part of the daily aches of getting older. A little swelling in the evening, tired feet after a long walk, or skin that seems a bit dry, all of this feels normal. But what if it is not? What if those changes are not signs of aging, but your body quietly warning you about something beneath the surface? The truth is, your lower legs can reveal a great deal about your circulation, heart health, and overall vascular system. That area, especially around the shins and ankles, often becomes the first place where problems show up. And unfortunately, those signs are easy to ignore until they are not. Let us talk about swelling first. Mild swelling after sitting or standing for long periods can happen to anyone. But for seniors, regular or worsening swelling in the ankles and lower legs can be an early sign of poor circulation, fluid retention, or even heart failure. When the heart is not pumping efficiently, fluid can begin to build up in the extremities and gravity pulls that fluid down into the legs. If you find yourself taking your socks off and seeing deep marks where they dug into your skin, or if your legs feel unusually heavy, that is not something to brush off. Especially if the swelling happens on just one side or comes with warmth, redness, or tightness, those are signs that need medical attention. You could be dealing with a condition called deep vein thrombosis, or DVT, which is a type of blood clot. Left untreated, DVT can lead to a pulmonary embolism, a potentially life-threatening condition. Another major warning sign is skin changes. Are your shins becoming shiny or discolored? Are you seeing patches of redness or even dark spots? Has the skin become thin and fragile, or are you noticing wounds that take forever to heal? These are all signs that blood and oxygen are not reaching the area like they should. In some cases, this can lead to venous insufficiency or even early stages of peripheral artery disease, a condition where narrowed arteries reduce blood flow to the limbs. What makes all this worse is that it creeps up slowly. A little swelling here, a sore there. Before you know it, you are adjusting your socks higher, keeping your legs up more often, and telling yourself it is just normal aging. But aging does not mean suffering in silence. These symptoms are your body's early alert system, and if you listen, you can often stop a serious condition from developing. Now, let us talk about the importance of movement. A sedentary lifestyle, especially common in older adults, can actually make these problems worse. When you sit or lie down for long periods, blood flow slows, which increases your risk for clot formation. That is why doctors often recommend gentle leg movements, compression socks, or regular walks, even for those with limited mobility. The muscles in your calves are like a second heart. They help push blood back up toward your chest. But if those muscles are not used, the blood pools. And where blood pools, trouble follows. This is especially true if you have other risk factors like diabetes, obesity, or a history of smoking. It is also important to pay attention to leg cramps. Many seniors wake up in the middle of the night with painful spasms in the lower legs. Sometimes, this is due to dehydration or mineral imbalances. But in other cases, it is because of reduced blood flow. If leg cramps are frequent and not linked to any new medications or lifestyle changes, it is worth discussing with your doctor. You should also not ignore the texture of your skin. If the skin feels waxy, unusually dry, or has lost its normal elasticity, that could be another sign of circulation issues. When blood and nutrients are not reaching the tissue, the skin begins to show it long before pain or serious symptoms arrive. So what should you do? Start by inspecting your legs daily. Use a mirror if needed. Look for swelling, color changes, texture shifts, or anything that feels new. Elevate your legs if they feel heavy. Walk or stretch every hour if you sit for long periods. And most importantly, share any new leg issues with your doctor, especially if they are one-sided worsening, or come with tenderness. The legs carry you through life, but after 60, they also carry your secrets. The signs are there. You just have to look. Body spot 3, the scalp or back of the neck. The spot you cannot see but should never ignore. There is a quiet danger in the places we cannot easily see. The scalp and the back of the neck are two of those places. For many seniors, these areas are often forgotten, hidden beneath hair, covered by collars, or simply too difficult to inspect. But just because you cannot see it does not mean nothing is happening there. In fact, ignoring these spots could lead to one of the most preventable but deadly conditions in older adults: skin cancer. As we age, our skin becomes more vulnerable. Years of sun exposure begin to add up. The scalp, especially for men with thinning or no hair, is constantly exposed to UV rays. And the back of the neck, often missed when applying sunscreen, is in direct line of sunlight for most of our lives. This long-term exposure creates a perfect environment for skin damage, abnormal cell growth, and potentially melanoma. What makes this even more dangerous is that seniors often do not notice these changes: a small scab that does not heal, a mole that begins to itch, a rough patch of skin that feels thicker than usual. These signs are dismissed as age spots or minor irritations, but they are not always harmless. Basal cell carcinoma, squamous cell carcinoma, and melanoma often appear on the scalp or neck. Left unnoticed, they can grow deeper and spread before you even realize they are there. Even more alarming is that these cancers may not be visible in the mirror. Unless someone is checking your scalp regularly, especially the crown of the head or behind the ears, changes can go undetected for months. Many seniors only discover something is wrong when a loved one points it out during a haircut or a doctor notices it during a checkup. Another overlooked factor is how often seniors experience bumps or sores from combs, hats, or even minor injuries to the scalp. These injuries may seem harmless but can mask growing lesions. If a spot bleeds easily, scabs repeatedly, or looks different from the surrounding skin, it needs professional attention. And for women, long hair can create a false sense of security. Just because the scalp is not fully visible does not mean it is protected. UV rays can penetrate through thinning hair. Over time, even small sunburns or dry patches can turn into something serious. So what should you be looking for? Any new or changing growth on the scalp or neck, a mole that has changed in color, size, or shape, a patch of skin that is itchy, painful, or bleeding, any sore that does not heal within 3 weeks. And remember, not all skin cancers are dark. Some may look like pearly bumps, flat red patches, or shiny, waxy nodules. If you have ever had sunburns, spent time outdoors without a hat, or used tanning products in your youth, you are at higher risk. That is why regular self-checks and professional skin exams are so important after 60. Early detection makes all the difference. Most skin cancers are treatable when found early. But when ignored, especially on the scalp or neck, they can invade deeper layers of skin, spread to lymph nodes, and become life-threatening. Here is a simple habit you can start today. Ask a family member, caregiver, or barber to take a close look at your scalp once a month. Use a handheld mirror to inspect the back of your neck. Take pictures of any moles or marks and track changes over time. And if something does not look right, do not wait. Dermatologists can perform a quick check and often identify dangerous spots before they become a problem. You should also protect these areas daily. Wear a wide-brimmed hat when outside. Use sunscreen on the back of your neck, even on cloudy days. Choose hair products that contain UV protection. And if you already have a history of skin issues, get your scalp professionally examined twice a year. It is easy to ignore what you cannot see. But your body does not stop signaling just because you are not looking. The scalp and back of the neck might seem like unimportant areas, but they are prime spots for hidden harm and powerful opportunities for early action. Because after 60, your health is not only about what you feel, it is also about what you cannot afford to miss. Body spot 4, the abdomen, especially the upper right side. The quiet pressure that deserves your full attention. Many seniors experience stomach discomfort from time to time, a little bloating after a heavy meal, a dull ache in the belly, or a fluttery feeling when stressed. Most of us chalk it up to gas, digestion, or something we ate. But when the discomfort consistently appears in the upper right side of the abdomen, it could mean something far more important is going on. That area is home to some of your body's most hardworking and delicate organs, and after 60, they need more attention than ever. The upper right side of your abdomen is where your liver and gallbladder live. These organs handle critical tasks like processing toxins, breaking down fats, and managing bile flow. When something begins to go wrong in this area, it often starts with quiet signs, a gentle fullness, a tightness that does not feel like a cramp, a pressure that appears, especially after eating, then goes away. At first, these signs are easy to dismiss. Many seniors attribute them to acid reflux or indigestion, but ongoing discomfort in this region should never be ignored. Conditions like gallstones, fatty liver disease, or even liver inflammation often begin without sharp pain. They begin with feelings that are vague and mild. That is why they often go untreated until the problem becomes more serious. Let us begin with gallstones. Gallstones are small, hardened deposits that can form in the gallbladder. They are more common in women, especially over the age of 60. But men are not immune either. These stones can block bile ducts and lead to sudden severe pain known as a gallbladder attack. However, in many seniors, the early signs appear as tenderness in the upper right abdomen, nausea after meals, or unusual burping and bloating. Now think about the liver. This incredible organ helps filter your blood, regulate hormones, and manage your body's energy. But the liver is sensitive. If it becomes fatty or inflamed, it can cause a feeling of pressure or discomfort in the same area. Some people even experience fatigue or itchiness on their skin as a sign that the liver is struggling. And because liver issues often develop silently, that upper right side discomfort might be your only clue. It is important to remember that not all pain in this area is sharp. In fact, sharp pain might mean you are already in the middle of a serious episode. What we are concerned with here is the ongoing, dull discomfort that lingers. It may feel like a heavy balloon under your rib cage, or like a deep soreness that returns after eating fried or fatty foods. Some seniors also report back pain or shoulder discomfort linked to gallbladder issues. This is because the nerves in the upper abdomen are connected to other parts of the body. That means your organs might be asking for help, even if the message is showing up elsewhere. So what should you do if you notice discomfort in this part of your abdomen? Start by paying close attention to patterns. When does the discomfort appear? Does it come after eating? Does it feel worse when you lie on your right side? Is there any nausea, yellowing of the skin or eyes, or unexplained fatigue? Write these symptoms down and discuss them with your healthcare provider. Simple blood tests and ultrasounds can help detect gallstones, liver problems, or infections in the bile ducts. These tests are not invasive and can often catch problems before they become emergencies. Early intervention means treatment can be done with medication, dietary changes, or simple procedures rather than surgery. Also, be mindful of your diet. Fried foods, excessive sugar, and alcohol all place added stress on your liver and gallbladder. Seniors often do not realize that even over-the-counter medications like acetaminophen can strain the liver if taken frequently. Protecting these organs means eating more fiber, drinking water, and reducing processed fats. And remember this: discomfort in the upper right abdomen is not something to feel embarrassed about or ashamed to mention. You are not complaining, you are advocating for your health. Your body is speaking to you in quiet ways. You just need to listen and respond with care. Because after 60, pain that whispers today can become a crisis tomorrow. But when you pay attention to those quiet signals, you give yourself the power to stay ahead of trouble. Body spot 5. The feet, especially the big toe or sole, where silent conditions often begin. Your feet carry you through every season of life, but after 60, they do more than support your steps. They quietly reveal what is going on deep inside your body. Yet for many seniors, the feet are the last thing to receive proper attention. They are out of sight, often covered in socks or shoes, and easy to overlook. That is a dangerous habit because problems in the feet are often the first sign of serious health conditions. One of the most important areas to watch is the big toe and the sole of the foot. That may sound strange at first, but these spots are where circulation problems, nerve damage, and even blood sugar issues often begin to show. And for seniors, especially those with diabetes or poor circulation, ignoring foot symptoms can lead to complications that are far more serious than most people realize. Let us start with numbness or tingling in the big toe. Many people think this is simply due to aging or cold weather. But frequent tingling or a dull, almost electric sensation in the toes can be an early sign of peripheral neuropathy. This condition, often linked to diabetes, involves damage to the nerves in your extremities. It typically begins in the feet and moves upward. At first, it might just feel like your sock is bunched up, but over time, the sensation becomes persistent, and once the nerves are damaged, they rarely heal fully. Another danger zone is the bottom of the foot. That area holds thousands of nerve endings and is critical for balance, mobility, and safety. Seniors who begin to lose sensation in the soles of their feet may not notice small cuts, pressure sores, or injuries, and when those go unnoticed, they can become infected. In more severe cases, untreated foot wounds have led to hospitalizations or even amputations, especially in diabetic patients. But it is not just nerve issues that make this area so important. Your foot health reflects your blood flow. If you notice cold feet, slow-growing toenails, or dry, cracking skin on your soles, that could mean your circulation is not what it used to be. Poor blood flow means your tissues are not receiving enough oxygen or nutrients. Over time, this can cause tissue breakdown and open the door to infections. One particularly serious sign is a sore or wound on the big toe or sole that will not heal. Even if it is small, do not ignore it. If you press on the area and it feels tender, or if the skin is discolored, shiny, or breaking down, it is time to seek medical attention. This could be a sign of a diabetic ulcer or vascular issue that requires immediate care. So what can you do to protect your feet? First, inspect them every day. Yes, every single day. Use a mirror or ask a loved one to help if bending is difficult. Check for cuts, blisters, discoloration, or changes in temperature. Even something as simple as redness around the toenail could signal an infection. Second, wear comfortable shoes with proper support. Seniors should avoid tight footwear or shoes that crowd the toes. Improper footwear leads to pressure points, corns, calluses, and other conditions that increase the risk of infection. Choose socks that are clean, breathable, and not too tight at the ankles. Third, moisturize your feet daily, but avoid applying lotion between the toes. That area needs to stay dry to prevent fungal infections. Trim your toenails regularly, but if you have trouble seeing or reaching your feet, have a podiatrist help you. One small mistake with nail trimming can lead to an ingrown toenail or infection. And most importantly, do not try to treat serious foot issues at home. If you notice swelling, ulcers, bleeding, or persistent pain, go to a healthcare provider. Let a professional assess your circulation, nerve function, and skin integrity. Simple tests can reveal problems early, allowing for proper treatment before it becomes urgent. Your feet are not just tools for walking, they are windows into your overall health. When something is off in your body, your feet are often the first place to show it. But they will only tell their story if you are listening. Because after 60, it is not just about taking steps. It is about making sure every step you take is safe, supported, and guided by awareness. Your body has a quiet wisdom. It speaks through small signals, subtle aches, and changes that are easy to miss. But after 60, listening closely can make all the difference. Each of these 5 body spots is not just a part of you, it is a messenger. Whether it is your shoulder, your legs, your scalp, your abdomen, or your feet, paying attention today could protect your independence, your health, or even your life tomorrow. If this video helped you, please take a moment to like, comment, and subscribe. And if you know someone over 60 who needs this message, share it with them. You never know whose life it might change just by paying attention.